Vice Chair Frederick, would you like to move your bill?
Yes, Mr. Chair, I move that House File 1494 be referred to the Human Services Finance Committee.
Okay, very good. Vice Chair Frederick moves to refer House File 1494 to the Human Services Finance Committee, and I understand you have a DE amendment. Would you like to move your DE amendment?
Yes, Mr. Chair, I'd like to move the DE amendment. There were several revisions after countless hours of meetings with stakeholders, after 8 revisions to the amendment. I think 8? Is that what, yeah, 8 revisions to the amendment. This is where we landed on, and hopefully we will be able to pass as a committee.
Okay. We have the DE2 amendment. Are there any questions? This is to get the bill in the shape the author would like. Not seeing any. Members, all in favor of the DE2 author's amendment, signify by saying aye. Aye. Opposed, say nay. Motion carries, and the House File 1494 is amended with the DE2 author's amendment. Vice Chair Frederick, please go ahead and explain your bill.
Thank you, Mr. Chair and committee members. This bill is a personal one to me. Those that know me know that I've spent 18 years working at St. Peter at our state's maximum security psych hospital. In my time there, I have been assaulted. I've had every bodily fluid thrown at me. I've been witness to having countless coworkers been assaulted, and some more severe than others. Some are still disabled to this day because of the injuries that they have suffered on the job. It has been a challenge at times to work there, a challenge to show up to work. And so when I had the opportunity to work on legislation that can attempt to help improve workplace safety across the human services sector, I jumped at it. I do feel the need to clarify something here, and I want to be very clear in my language use here. In the spectrum of mental health services across the state, the overwhelming majority of people who are receiving services of some type on that spectrum are very peaceful, just trying to live their best life and not a source of violence or harm in any way, shape, or form. That's the overwhelming majority. But it is important to acknowledge that in some workplaces, workers are put in harm's way. It is small, but it is happening. And so that's why I want to be very clear to not try to stigmatize or frame this as everyone who has some sort of mental health challenge in a way that they fit into this category. And so I cannot stress that enough. But it is important in the work that we do in the legislature to say we see everyone, and that also includes people that are working in situations where harm does happen. And so working with stakeholders, I have had murders at my facility where I work on the very unit that I worked on. And that, unfortunately, that has even happened in other facilities as well within the human services space. But that's extreme examples, but it has happened along with sexual assaults and physical assaults. And we need to do everything we can to address safety from every perspective possible. Unfortunately, this conversation also comes at a time where there's also an unprecedented workforce shortage that no sector within human services is untouched by. The workforce shortage is expected to get worse over the next 10 years if we don't take action. Burnout and turnover among those workers is at an all-time high. While solutions such as increasing wages, reimbursement rates, student loan forgiveness, sign-on bonuses, all those are really good things, it does not address the specific angle of workplace safety. I want to say that these issues are complex and require us to be conscious about how we describe them, which is why I have tried to be as crystal clear in my testimony right now to not try to stigmatize and put everyone into one bubble, because I do not believe that to be true. And in preparation for this hearing, testifiers and we have talked to be very conscious about the language that we use. However, it is one for me that is very personal, and I know that I can get emotional about this because of my friends and my colleagues that I've seen get harmed in such severe ways. We encourage members to do the same in our discussion. Unfortunately, this can be a difficult conversation to have, but it's one that we must have to ensure our future human services workforce. And members, I urge you to support this bill, and I would like to turn it over to testifiers at this point, Mr. Chair.
Thank you, Vice Chair Frederick. Our first testifier we have is Director Michelle San-Cartier. Welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Thank you, Mr. Chair and members of the committee. I don't know if this is, all right, cool. Thank you, Mr. Chair and members of the committee. My name is Michelle San-Cartier, and as Chair Fisher said, I'm the Director of Public Policy and Advocacy with Minnesota Social Service Association. MSSA is an organization of over 4,000 human service professionals from across the state who work in all areas of human services. And I'm here today to urge you to support House File 1494, which would establish a grant to help ensure health and human services provider safety. I have a background in human services, hold a master's in social work and public health, and have worked in direct practice. Now, like many of you, I work in an office. I have assurance that I'll be safe at work. I've never faced any threat to my physical safety, and even faced with some of the very interesting situations we all encounter here at the Capitol, I don't face significant threats to my psychological safety either. This isn't the case for many human service providers. Many don't have the assurance that they'll be safe at work. When they do advocate for their safety, they're sometimes even told that they're exaggerating, bad at their jobs, or even that they're bad people. The reality is, unsafe situations in human services exist and won't go away by ignoring them. We've heard it loud and clear. This is a problem and it needs to be addressed now. Many MSSA members have bravely shared their experiences with us, including multiple members who were sexually harassed, a member who had a proposed date of death written on a billboard in the middle of town, a member who had major damage done to their vehicle, a member who was threatened with a gun, more than one story of a homicide in a facility where clients lived and providers worked, multiple members who were stalked, and many members who didn't have the training they needed to de-escalate a dangerous situation. Our agencies are desperately trying their best, but they're under-resourced and understaffed. This bill would authorize the Minnesota Department of Human Services to award grants to human service organizations to invest in workplace safety measures. Grants would be used to pay for things like safety training, safety equipment, facility safety improvements, counseling, and systems to track, monitor, and prevent safety incidents. We're proud that MSSA is leading this conversation about workplace safety. The fact of the matter is, when we make the decision to ignore workplace safety for human services, we send a clear message about who we value. We're in the midst of a workforce crisis. As Representative Frederick mentioned, that's projected to get worse. Human service providers will be needed more than ever, and they're not going to tolerate working in positions that don't ensure their safety. We must act on this now. I urge you to pass House File 1494 and show our professionals that we value them. Thank you so much, Mr. Chair and members of the committee.
You're welcome. Thank you so much for your testimony and for being here today. Next, I have Mason Schliff. If you'd like to come forward, welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Thank you, Mr. Chair, members of the committee. My name is Mason Schleif, and I am a community human service provider and a Master of Social Work student. I am here today to speak in support of House File 1494, share my experiences with safety incidents in the workplace, and to urge you to make a change to ensure the safety of human service professionals in the workplace like myself. While working with clients in the community, I've experienced multiple safety incidents that have significantly impacted my life. Earlier on in my career, I met with a client before they left for their next appointment. When it came time to transition and leave, the client became escalated, yelling and screaming at me. They then proceeded to kick, punch, and spit on me. I was unable to leave because if I did, my client's safety was at risk. I did not have any support to get myself out of this situation either. I ended up staying with them and enduring the strikes until I was able to contact a peer over the phone who came to help me. After that, I was truly terrified to be around that client, and I had to step away from providing services directly to that client. I think back and I wish that there were safety resources such as safety training that were available to me at that time that I could have used to prevent the situation from escalating. I think if I had these resources, I would have been able to better protect both myself and my client. Instead, it was a terrible experience for both of us. In another position, I worked at a housing complex where an individual was murdered. Safety equipment did not exist in the facility, which meant that, unfortunately, the case has still continued to be unsolved. I spent many hours working in that facility completely alone, which was an expectation for working in my role. It was deeply unsettling to me that this case continues to be unsolved and that the safety of myself, my staff, and my clients would still be at risk. Additionally, after the murder and to this time, I've struggled to process what has truly happened. I had to take unpaid time off to receive therapy and process through the situation and my experience. The lack of safety precautions were entirely normalized at my organization, and I hadn't seen how few resources were available to protect staff and our clients until after this extreme event happened. In my current role, I provide crisis intervention and prevention training. Staff in my training often bring forward concerns about the lack of safety resources available to them, particularly those who serve in rural areas. Being in unsafe situations has been so normalized, and many of my staff don't even realize how unsafe those situations truly are. Having personally experienced being unsafe working in human resources or human services and hearing more experiences from my team, I have been motivated to voice the need for change. I want to do the very best for my clients, and in order to do that, I need to be safe on the job. By passing this bill, you can help ensure workplace safety for current and future human service providers. You can help prevent situations like what I experienced in my work and ensure providers are able to successfully and safely serve their clients. Thank you, Mr. Chair, members of the committee.
Thank you, Ms. Schleif, for being here and sharing your experiences with us.
Absolutely.
Next, I have Director Beth Ringer. Welcome to the committee. Thank you for being here. Please introduce yourself and begin your testimony.
Thank you, Mr. Chair, members of the committee. My name is Beth Ringer, and I'm the Executive Director of the Minnesota Social Service Association. I also hold an MSW, and I'm a licensed graduate social worker. In my conversations with MSSA members, it is rare that I meet someone who does not have a personal story about a workplace safety incident. I want to tell a story today of one of MSSA's members, Megan, who was unable to join us in person today. Megan says, "In October 2021, I experienced a physical and sexual assault while on the job. Soon after I started my job, I experienced a situation where I was threatened and yelled at. I did not feel safe going into the home again, but I didn't have the tools or resources to effectively communicate this or keep myself safe. Later, in September 2021, I experienced the joy of getting married. Prior to taking time off for my wedding, I received a case involving a client who needed to meet face-to-face. The events that followed at our first meeting were traumatic and have deeply affected my life. During that meeting, I was physically and sexually assaulted. I'm not going to go into detail about the assault because I want to keep this conversation focused on solution. But at our first meeting, my breasts were grabbed, my crotch was touched, and I was choked. It was a living nightmare and has left me with a great deal of post-traumatic stress. I share the journey of marriage in my life to highlight that I am a human, not just an employee and not just a provider. This event has not only impacted my ability to trust others, but has increased my overall anxiety in day-to-day situations. I care deeply about my clients. I want to do my best work for them, and in order to do that, I need assurance that my safety matters. I need resources in order to keep myself and my clients safe. Megan's story isn't unique. Workplace safety incidents are normalized in human services and are a critical part of the reason that workers are leaving or not going into this field. And this bill offers us an opportunity to begin addressing this issue. Thank you.
You're welcome. Thank you so much for your testimony. Is there anyone else from the public that would like to testify on House File 1494? Hearing none. Thank you so much. Members, we will now go to members' questions or discussion. Representative Baker.
Thank you, Mr. Chair. Thank you, Representative Frederick, for bringing this. I certainly see, my tours at Cabs Hospital and things like that, where things can get very, dangerous for a lot of staff and for the patients that are there too. And I kind of get what you're trying to get to. My question might be, how will we decide who gets the money? And with DHS being part of the receiver of the money, and DHS not being receiver of all the money, if I miss the language in here, because I do know that DHS has a good granting and a very robust scoring system, but how will this be handled as to who actually will receive some of the funds? Is there a scoring system, and how does this work?
Representative Frederick.
Thank you, Mr. Chair. Thank you, Representative Baker. I would say that some of the initial rounds for this grant money, we really wanted to put an emphasis on the greatest need. And the feedback that we had gotten from administering this grant program is, how do you establish what the greatest need is? Because situations can be so different from one to the next. And to place a value judgment that this need is greater than this need, it admittedly could almost be impossible to do. And so the feedback that we had gotten from the department was the preference to do more of a first come, first served basis. And so while that may mean not everyone who needs to hopefully benefit from this piece of legislation may not be able to at the end, that is how it is currently established in the amendment, is just as a first come, first served.
Representative Baker.
Mr. Chair, okay. Is it going to be based on, again, first come, first serve? I get it. DHS is setting up the program, and they could certainly be first in line. And my concern would be, not that they shouldn't be considered, because they've got some of the folks, they got some of the areas that nobody else wants to touch. And so I know that they should be eligible. Again, in the hotel industry, we have these panic buttons that housekeepers can wear. They get stuck in a room, somebody closes a door, something's going on, they can just push a quick button and it goes off at the front desk, and we immediately have people there. And that costs money to have that done. And I don't know if that kind of thing exists now in most of those settings where, example, one of your testifiers, had been assaulted. Was there anything like that available to them? But I just want to make sure, with a limited number of one-time dollars, that this somehow doesn't get seen as who got to the pot first, where maybe you're using metrics like where were the most workplace injuries at, or is there some kind of metrics that will elevate this to that kind of level, I think is what I'm looking for. Again, I don't think you have all the answers, but I know that it's going to be questions that we need to get right before we pass a bill like this, so that we can go home and talk about this, that we think we try to get it to the right people with the right kind of a metrics that will get it to the right people first.
Representative Frederick.
Thank you, Mr. Chair. So a couple different pieces to that. One, on the DE amendment, line 1.14, where it talks about eligible applicants include county human service agencies. So it's not the state while state level DHS is going to be the one kind of administering the program, they will not be the beneficiary of it. So we're talking county level human service agencies, tribal human service agencies, and otherwise our private sector human services partners would also be eligible to it. To the point of if one facility is having multiple incidences. The challenge is if you have one facility that's having 100 incidents, but they're kind of more of a minor incident, where's the priority if you have a different place that is having 2, but they're severe? It's a value judgment. Who gets it in that case? Or what if they're moderate and somewhere in the middle? Like, how do you rank one from the next? And that is one where we couldn't get an answer to. Like, no one has I don't think a good answer exists. And so if anyone on this committee has feedback for me on that, I'd love to hear it. I don't believe that there is any way to put a true value judgment on a lot of those really hard situations that I think everyone would agree hopefully just doesn't happen.
And thank you, Representative Frederick. And I'll also point out on the DE2 amendment at line 1.1, it does say 40% of the grant funds going, and this goes on to line 1.12, 40% of the grant funds of each fiscal year must be awarded to eligible organizations outside the 7-county metro area. So there is some attempt trying to get at how do we make sure that we're getting it across to the different areas of the state that we do need. Representative Baker.
Mr. Chair, follow up. And I get that, and I thank you, and I saw the 40%. And I think I kind of missed where the county, human service agencies, the tribal human services, and then others, including agencies. So again, I'm assuming DHS is eligible for these grants too?
Representative Frederick.
In our conversations, it would not be eligible since they are going to be the ones who are administering the program. That's been our communications with them.
I understand.
Representative Baker.
Okay. Mr. Chair, I guess I read that wrong then. So that's where I was kind of going with my questioning is, okay, how do we get that? So I appreciate that. I'm not saying that either they should be ignored because, again, they have, like in your case, and I appreciate you bringing this forward, those are some of the most dangerous places. And I want to make sure that our state is providing that protection now for those workers. I think, in my case, with our CABS hospital, and I think other places, which I've had some tours with, I think they do a pretty good job. But again, I don't want them also ignored. So I was actually just considering maybe we should have some county folks involved with this greater good of how we kind of make those decisions. But I think your bill is not going in that direction, is what you're telling me. It's worded where I read it as it could be or agencies, which is very broad. So that's all I have, I guess, Mr. Chair. Again, I like what you're doing. It's about worker safety. It's investments that we need to do, and I think this is a little bit outside of our normal operating, reimbursements to counties and so on. We've got to find better ways of making these, again, sometimes older facilities more safe. Cameras are super important, barriers, buzzers, all those things. So again, I like where it's going. I just want to make sure we cook it out right with who's making those decisions. So thank you. Thank you.
Thank you, Representative Baker. Any other comments? Representative Engen.
Thank you, Mr. Chair, and thank you for bringing this forward. I'm actually going to be signing on or requesting to sign on to this bill. I think that this should have been addressed a long time ago. I've heard horror stories of folks who are just trying to do their job and do it well, and they go in because they have a passion for this. They go in because they want to care for people, and we've thanked them time and again in this committee, and we're not providing support and safety. This should have been addressed a long time ago, but thank you for bringing this forward, and would love to talk after this and see how we can make sure that this happens everywhere.
Thank you, Representative Engen. Representative Frederick, I want to say thank you for bringing the bill forward. You've done a lot of work, I know, on this issue. I appreciate the way the focus has been on trying to figure out what are the services that we can provide, make sure that in terms of trainings, focusing on what we can be doing as providers, what are the systems that can be built out to help provide that safety. And you've been very clear as this is not about penalizing people who might have been in some kind of psychosis or something else that can't control it. So I very much want to say I appreciate the work that you and the advocates have been doing to foster this discussion, moving it forward. I also know that this is very important. I think that this is something that can also be highly scalable to help get it started and then take a look to keep this going as we move forward. With that, Representative Frederick, any closing comments, and would you like to renew your motion?
Thank you, Mr. Chair, and thank you, committee. I feel it's important to say it again. I said it once already, but I'm going to say it again. The overwhelming majority of people that are served in some sort of human services capacity are not in any way like threatening or harmful. They're amazing people. But this bill simply seeks to acknowledge that small portion where there is harm happening, and whether it is the barriers or things like that happen. There's also outlined in the bill that we can do training ahead of time to try to prevent like de-escalation training, even so we don't get to that point. But if something bad happens, then you can use this money for counseling services afterwards too. So it tries to take a look at every stage of as we go to try to create a safer experience. And again, the wages, the reimbursement rates, all of that super important too. And so this is just one piece of the bigger puzzle. And so I want to thank MSSA and the absolute countless hours that they have put in working on this bill as well. So thank you for that. And thank you to the committee. And I renew my motion that House File 1494 as amended be referred to the Human Services Finance Committee.
All those in favor of referring House File 1494 as amended to the Human Services Finance Committee signify by saying aye. Aye. Opposed, say nay. Motion is approved, and House File 1494, as amended, is referred to the Human Services Finance Committee.